The story about climate change and its effect on the health of human populations it's a big story. And over the last 10,000 years, the big killers have all been climate related. Food shortages and famines, the spread of various infectious diseases, extreme weather events, of course, and often conflict over dwindling resources. None of these are good for health. And that story continues today, but it does so in many different ways. Just a couple of quick examples. This is a direct effect from Melbourne in Australia in January 2009, and you can see the maximum daily temperature raced up to about 45 degrees centigrade, which is way above any sort of seasonal average. And there was a huge increase in the demand on the healthcare system and a threefold increase in the number of deaths during that episode. Infectious diseases. We know that many of them are sensitive to climate. We're now starting to see evidence that some of them are changing their patterns of occurrence around the world, including, just for example, the recent arrival of West Nile virus in the very hot summer of 1999 in New York City, or in China, the northward spread of the water snails that spread often fatal condition, schistosomiasis. And finally, a disruption of the ecology of bats in many parts of the world is bringing us into closer contact with the many viruses that bats naturally contain, including things like Nipah virus in Malaysia and some of the more serious viruses in parts of Africa that are very fatal. Let's look at a future scenario where the world is very likely to be 2 degrees centigrade warmer than it has been in recent time. Firstly, the issue of the spread of malaria in response to climate change. Some work that was done in Zimbabwe provides rather a nice example, and you can see here for the year 2000 the estimated distribution of the risk of malaria in Zimbabwe. Red represents very high risk in the lowlands, and the greens and blues represent low risks up there in the highlands where the big populations live. Now, if we fast forward to 2025, you'll see that the red area spreads at higher altitudes, and through to 2050, most of the country faces a serious risk of malaria. Another example refers to the typical relationship between daily temperature and daily deaths in many cities around the world. And notice that there's a comfort zone when we're living within that 25 to 28 degrees centigrade region. But as you move to higher temperatures, the risks start to go up pretty strongly. So these are just two examples of what we might see in a 2 degrees centigrade future world. But the more serious issue that's coming onto our agenda now is a 4 degrees centigrade increase, which could occur by the end of this century. Here you see we've shifted that curve 4 degrees centigrade, but it doesn't just comfortably shift the whole curve across. It means that we get to that steep uprise rather quicker, and we're not sure where it's going to take us in future as we move beyond the usual range of temperature. Will it go up and up as a cause of death, or will it start to turn a corner as we reach some sort of saturation point? We don't know. And I'm afraid we won't know until we get there, and by then it'll be rather late. The other example that illustrates what could happen in a 4 degrees centigrade world that I want to show is to do with malaria. On the left you see the infectious agent itself multiplying and maturing more rapidly within the mosquito as temperatures rise, and on the right you see mosquito biology and behaviour changing with increasing temperature. Put them all together and you get that sort of graph at the bottom, showing just how temperature dependent the transmission of this disease by mosquitoes actually is. Now, raise the temperatures by 4 degrees in a part of the world that's now at around 20 degrees centigrade. Look how sharply the increase occurs. And most of that comes from this halving of the incubation time. And finally, what do we do about all of this? Well, we can avert climate change. We must. That's the first order business. But we've let things go a bit too long. Risks are now compounding and we need to adapt. The great benefit in health terms from taking robust action to avert climate change, to mitigate, is that the populations that do it will experience considerable local benefits to their health, from cleaner air, more physical activity with better transport systems, better insulated housing, and changes in food systems in ways that will be good for their health and good for the environment. So, in conclusion, human health and survival, it's really a key marker of the disruption of the foundations of population health. Second, most climate change impacts on natural, managed and social environmental systems adversely affect our health, particularly in poor and vulnerable populations. Third, we must learn to think about the impacts on populations in more ecological terms. This is not an individual risk factor. It's to do with whole communities. Fourth, sustaining and improving human health requires us to avert climate change and to restore Earth's life support systems. And finally, health co-benefits are an extra dividend to local populations when they and their governments undertake local mitigation or actions to avert climate change. So when you next join a discussion about climate change and its impacts, be sure to bring the human impacts topic into that discussion. Climate change isn't just something big, complex, somewhere out there. It always has been central to the well-being and stability of societies and to the health of the one species in which we inevitably have a particular interest, the human species.